Hello. Today you will be learning about some evidence-based practice measures to prevent falls and improve safety. I'd like to first thank you for making fall prevention and resident safety a priority every day. By participating in this fall prevention education and in the implementation of the recommended fall prevention interventions, you are demonstrating your commitment to resident safety. My name is Erin Smith, and I am a graduate student at the University of Hartford. This fall prevention initiative is a quality improvement project. Following a facility needs assessment and discussion with the Director of Nursing, it was determined that this facility has higher than average rates of long-term care residents who sustain falls with major injuries, and that a quality improvement initiative with a focus on fall prevention was needed. After reviewing this facility's current fall policies and protocols, it was identified that the addition of purposeful rounding to the existing fall prevention program may help reduce facility fall rates. This training will examine falls and fall-related injuries among those 65 and older, as well as the factors that increase one's risk for falling. I will also explain the process of purposeful rounding and plans for implementation. To first provide some background surrounding this issue, in 2020, there were approximately 55 million people in the United States aged 65 and above. This age group has grown 5 times faster than any previous generation, and by 2030 it is estimated that 1 in 5 individuals will be 65 and older. This rapid growth may be attributed to a large baby boomer population, life-saving and extending medical and technological advances, as well as disease prevention and health promotion initiatives. However, as the older population continues to grow, so do the rates of falls. Currently, falls are the highest risk for injury and death among this aged population, and it is estimated that 1 in 4 seniors fall annually in the U.S. Falls among this cohort can result in adverse consequences for the individuals, including a reduction in quality of life, an inability to function due to injury. These individuals may experience an increased fear of falling and restrict activities, which can compound issues of muscle weakness. They may suffer from severe injuries because of falls and potentially death. In 2018, 36 million individuals aged 65 and older reported falling, and 8 million of those resulted in an injury. These injuries incurred approximately $50 billion in medical costs. The fall-related deaths among this cohort have also increased from 55.3 deaths per 100,000 in 2012 to 78 deaths per 100,000 in 2021. Unfortunately, the occurrence of falls increases for the 1.6 million elders residing in nursing homes. Fall rates among nursing home residents are more than double those 65 and older living in the community setting, with an estimated 50 to 75% of nursing home residents falling, and an average of 2.6 falls per resident every year. 10 to 20% of those falls result in serious injury and 1,800 deaths annually. Falls can also be detrimental to healthcare facilities. From a provider's perspective, this can include increased paperwork, increased levels of care, poor survey results, potential lawsuits, higher insurance premiums, poor patient and family satisfaction, decreased market share, and revenue loss. So why are individuals 65 and older at an increased risk of falls? Well, falls are multifactorial in nature. That is to say, there are many reasons why one falls, and the reasons are classified into 3 distinct factors, namely internal or intrinsic, external or extrinsic, and situational. Internal factors are those occurring within the individual. They can include the effects of aging on gait, balance, and strength, acute medical conditions, chronic diseases, deconditioning from inactivity, behavioral symptoms and unsafe behaviors, or medication side effects. External fall risk factors are those occurring outside the individual, such as environmental hazards and unsafe equipment or personal care items. These may include poor lighting, cluttered living area, uneven or wet floor surfaces, unstable furniture, unstable bed wheels, ineffective or unlocked wheelchair brakes, missing equipment parts, improper footwear, difficult to manage clothing, or the inability to access personal items. Situational factors within a facility can include those newly admitted residents, recent room changes, or perhaps a new roommate. However, despite the cause of falls, experts agree that falls are not a normal part of aging and can be prevented. That brings us to purposeful rounding. Purposeful rounding is an effective intervention that has proven to help reduce falls in both acute and long-term care settings. Purposeful rounding, sometimes referred to as intentional or even hourly rounding, is a proactive intervention that helps nursing staff to anticipate and address residents' needs by utilizing a checklist intended to promote a clean, comfortable, and safe environment. In other words, rather than merely performing a quick visual check, staff are very mindful in their approach and proactively address the residents' needs, thereby eliminating many of the factors that could increase the risk for falls. Purposeful rounding is not a new concept. Originating in the US, this practice began in acute care settings. However, there is a growing body of research and literature to support this practice in the long-term care setting. Some of the benefits to purposeful rounding include the reduction of falls. This may be attributed to the caregivers proactively meeting the residents' needs. This could be especially helpful for a resident population that suffers cognitive impairment, such as dementia. These individuals may not remember to call for assistance. However, if the individual's needs are met routinely, they may be less compelled to get up unassisted. Another benefit is the decreased risk for pressure ulcers. This comes to no surprise, as individuals who have compromised mobility are repositioned regularly should develop fewer pressure ulcers. Research surrounding purposeful rounding has also shown a decrease in call bell usage. This would be an expected outcome if needs are being met proactively or before the individual needs to call for assistance. There will be fewer call lights. And finally, improved resident, family, and staff satisfaction. Since needs are being met proactively, care is less likely to be delayed. Additionally, since care is bundled, staff are less likely to be chasing call bells. Although the duration of time between rounding can vary according to facility preferences, time of day, and patient acuity, it generally occurs every 1 to 2 hours. However, the duration could be shortened to 30 minutes for those identified as high risk for falling. As previously mentioned, purposeful rounding typically includes a checklist. One of the most common checklists utilized is the 4 Ps. The 4 Ps are a mnemonic tool to help nursing staff remember what they should check for while performing purposeful rounds. They include the evaluation of pain. CNA should ask the resident if they are having pain and observe for any signs of discomfort. Any reports of pain or signs of discomfort, anxiety, or agitation should be relayed to the charge nurse, and the charge nurse can then further evaluate and treat accordingly, whether it be to medicate the resident or report to the primary care provider. Next is positioning, to ensure that the resident is in a safe location and properly positioned, taking note of any abnormal posture while sitting in a chair or perhaps an extremity that is hanging off the bed. The resident should be repositioned accordingly as scheduled and or needed. Check to ensure that the bed, walker, and or wheelchair is locked as appropriate. The third P is to evaluate personal hygiene or potty needs as scheduled or required. Again, an ounce of prevention is worth a pound of cure. It's best to ask the resident while rounding if they need the bedpan or toilet rather than they attempt unassisted and potentially sustain a fall. You typically may not wake a resident up to ask them unless if they needed toileting, unless they were in a toileting or incontinence care schedule. But if they're awake, it would be good to offer. Finally, to ensure all personal needs or desired possessions are within the resident's reach. Call bell, telephone, water pitcher, mobility device as appropriate or care planned. All of these actions can help prevent falls. Sometimes staff members may find it helpful to have some kind of scripting available. So here are just a few suggestions. First, you should introduce yourself. This is especially important for newly admitted residents and those who may forget where they are or who you are. Next, evaluate for pain or discomfort, such as asking questions like, are you having any pain? How are you feeling? Then ask, are you comfortable? And observe where the resident is positioned. Are they slouched in their chair? Are their extremities hanging off the edge of the bed? To evaluate for personal hygiene, ask, do you need to use the bathroom or bedpan? If the resident is incontinent, are they wet or soiled? Concerning personal needs, ask, can I get you anything? Do you have everything you need? And be observant of the location of their call bell, water, phone, etc. Finally, if appropriate, tell the resident when you will be returning and remind them to use their call bell if they need anything before your scheduled return. In addition to the 4 Ps, it is also important to perform an environmental scan and be mindful of any potential fall hazards. For example, is the bed at a low or appropriate height, and are the wheels locked as appropriate? Are side rails positioned as ordered and care planned? Concerning mobility devices, are wheels locked as indicated and appropriate? Is the device within the reach of the resident as care planned? Is the lighting adequate and functional? Are all cords secure? Are there any tripping hazard present? And is the floor clear and dry? It may be necessary to alert the charge nurse and or maintenance of any hazardous findings, and the resident's immediate safety will always come first. To help implement this intervention, new check flow sheets have been created for both 30-minute and hourly checks. However, even individuals who are not on scheduled checks would benefit from purposeful rounding, the evaluation of the 4 Ps, as well as checking for any environmental hazards routinely. Reminders for purposeful rounding, the 4 Ps, environmental scanning, and potential scripting will be made available to nursing staff. As healthcare professionals, it is imperative that we provide the highest quality of care for those we serve. In the long-term setting, it has been identified that the older population is at high risk for falls and fall-related injuries and death. We know that falls are multifactorial in nature, but can be prevented. And despite the many fall prevention interventions, there's always room for improvement. Purposeful rounding has proved to be an effective intervention to fall prevention. However, for this intervention to be successful, staff must be committed to implementing and sustaining it. I would like to sincerely thank you for your time and attention. Together, we can successfully promote safety and prevent falls within this facility. I look forward to seeing the results of everyone's efforts over the next few months. Take care. My references to follow.